Hi, are you Rachel?
Yes, I am.
I'm one of the student nurses here. I'm going to be following you around today. Is that okay?
Sure. That would be great.
Can you give me SBAR on the patient you're about to see?
Yes, I can. I am taking care of C9BF O'Connor, and she is a 34-year-old female. She's in room 231. She is full code. She's allergic to trimethoprim sulfamethoxazole, basically Bactrim.
Okay.
She was admitted earlier today with a fever, secondary diagnosis of end-stage renal disease. Little history here. She is a type 1 diabetic. She's been diabetic since she was 8 years old. She's been on dialysis for the past year. She has reported an increase in her blood glucose levels over the past few days, so probably related to possible infection. Like I said, she is admitted with a fever. Assessment-wise, her last vitals revealed blood pressure of 138/78, pulse of 95, respirations of 20, 96% O2 stats. She had a pain level of 4. Her temperature was 101.1. Neuro-wise, she is alert and oriented, well-groomed. She does have some numbness or tingling in her lower legs, and she is reporting that she's generally uncomfortable. It could be related to the fever. Respiratory, she has clear, her lungs are clear to auscultation in all lobes. She denies any shortness of breath. She does have a history of smoking. She quit about 2 years ago. Integument, she is warm and intact. Everything's fine there. She does have an AV graft in her left forearm for dialysis, and the IV we'll be working with today is in her right forearm. Cardiovascular, regular rhythm, S1 and S2. She has been tachycardic at times. Her heart rate has gone from 95 to 108, so in that range. She does have +1 non-pitting edema in her lower extremities. Her capillary refill is less than 4 seconds. She denies any chest pain or shortness of breath. GI and GU, she denies any issues here, or any pain, urinating, or with her bowel movement. She reports a decrease in output. She does report that her urine is dark in color and concentrated, and she has a history of recurrent UTIs. Her abdomen is soft and non-tender. Bowel sounds are present in all quads. She does report a decrease in appetite and some recent weight loss. Musculoskeletal, she denies any muscle or joint pain. Her strength is as expected. She has normal range of motions, no issues there. Recommendations with this patient here, we're going to do vitals as needed, of course, or at least every 4 hours. She's been ordered for INO every shift. We're going to monitor her diet. She is on the renal diet, and she has a fluid restriction of 1,500 mLs per day. Daily weights are ordered every morning, so we'll make sure we do that. Orders say to maintain her O2 stats at 92%. Call the doctor if her fever is over 101. Blood glucose will be taken at every meal and at bedtime. And call the doctor with readings over 180 or a fasting of 100, and her activity is as tolerated.
Okay.
Do you have any other questions?
Yeah, I have a few. Why specifically is this client receiving this medication?
So we are going to hook this client up to her primary line, and then her secondary is going to be the Primaxin, which is an anti-infective. She is receiving this medication because she has come in with a fever of unknown origin, so we're just going to hook this up kind of as a prophylactic to get her started on an anti-infective.
What action does this medication have on the body?
This medication is broad spectrum. It's going to kill gram-negative, gram-positive, and some anaerobes. It basically has a bactericidal effect.
Okay. When should you question administering this medication?
We would question administering the Primaxin if she had a sensitivity to penicillins or cephalosporins. We also want to time this with her dialysis. We would question it with renal impairment because it is excreted by the kidneys, but I've already called the pharmacist, and she went to dialysis this morning, so this is the appropriate time, and she's okay to get it even though she does have renal impairment.
Okay. Does this medication have a therapeutic serum level?
No, it doesn't.
And which vital signs must be monitored with this?
We're always going to monitor all vital signs, but You know, most importantly, we're going to be monitoring anything that relates to infection like fever, heart rate, blood pressure.
Okay. Let's see. Which physiological parameters should be monitored when this medication is being administered?
We are going to monitor, so like for signs of infiltration, or we'll monitor for signs of allergic reaction. We'll monitor lung sounds for wheezing, see if she has any issues breathing. This could indicate an allergic reaction.
All right. Let's see. What interventions must be taught to the client for safe use of the medication in the hospital?
The client will be taught to let us know if she has any signs or symptoms of infiltration, if she has any pain with the IV site. She'll also be instructed to let us know if she has any issues, you know, with rash or itching or trouble breathing that could indicate an allergic reaction. And then we'll also teach her about super infection and make sure that she knows the signs and symptoms of that, like black tongue or, you know, diarrhea, loose stool, that kind of thing, so she can report those to us too.
Okay. And let's see. What interventions must be taught for taking the medication safely at home?
Well, this is an IV medication. She's probably not going to go home on this, but if she goes home on any antibiotic, it's always going to be important to tell the patient that they have to take the medication as ordered. They can't stop, you know, if they feel better. So.
Right. And let's see. What are the side effects and potential adverse reactions to be looking for?
So I kind of already mentioned some. It would be like anaphylaxis. Also, this super infection could be an issue. Seizures, we want to monitor that with her too, and hypotension.
Okay. And how will you know that this medication has been effective?
We'll know this medication is effective if, you know, she rids of her fever and white blood cell count is normal and all that. We'll monitor those parameters and we'll document her response and everything in her health record.
Okay. Well, that's all the questions I had for now.
Okay. So we'll go in and hook the patient up to her IV.
Okay. Thank you. Just leave it.
Hi, Miss O'Connor. How are you?
I'm good.
Good. So I have come in to start you on just a broad spectrum antibiotic here. It's just an anti-infective. Doctor's suspicious of an infection because of your fever, so we're going to get you started on some medication, okay?
Okay.
I'm just going to wash my hands here. And I'm going to ask you to give me your name and age, please.
Shanae O'Connor, 34.
Okay, so I'm checking her band, and I'm checking against the MAR, and this is the correct patient, Shanae O'Connor, 34 years old. Are you allergic to anything?
Yes, Bactrim.
Okay. The wristband states the generic name for Bactrim, and that's also correct in the computer here. Very good. Okay, so the first thing I'm going to do is check your IV site. Do you remember when we talked earlier and there were some things I asked you to let me know if you started to feel with this IV?
Yes, I do. You said if it became red or painful or swollen that I should let you know.
Very good. And are you having any issues like that right now?
No.
Okay.
Seems okay to me.
So in order to flush, I'll make sure her line is not clamped. I'll clean the port for 15 seconds. Okay, so I'm just going to flush some water here. Let me know if you have any sensitivity, okay?
Okay.
Are you fine here?
Yeah, feels fine.
Okay, very good. So when you squirt the air out of this, you want to be careful that it doesn't go everywhere. Okay, so line is patent, so I'll go ahead and start to hook up her primary tubing first. Okay, so as I'm preparing to start the medication, I already checked it once when I was getting everything out in the medication room, but we do checks against the MAR just to make sure that it's the right patient, the right time, the right route, the right dose, the right medication. And I did say earlier that I called the pharmacy about her antibiotics, so we know that this patient can receive this medication. For the IV bag, we're looking to make sure everything's intact. We want this to be clear. We're checking for the expiration date. So all this is good here. And then another safety check will be to get the green light in the MAR, so I'll type in the patient ID so we can get that before I hang the bag. It just says scanning, please wait, so I'm just waiting to get that green light to make sure I safely administer the medication here. Refresh. Okay. Did you see? Alright, good. Okay, so I'm going to make sure my line is clamped here. And since everything is sterile, when I take this off, I'll make sure I don't touch it to anything except the bag. you just want to prime your primary tubing and make sure that there aren't any air bubbles there. And then we're using the dial flow today. We don't have the pump, so I'll also make sure we prime this before we hook it up. Since this is all new tubing, I don't have to clean the ports here. So to prime this styrofoam, I'm just going to turn it on and let it run through. Okay, and then before I hook this up to the patient, I will clean her port again. The dial flow is off right now. Once I get it hooked up, I'll set it to 30 mLs per hour because that's what the primary is running at. After 30. Make sure my line is open and I'll just watch for my drips here. Okay. Okay, now we'll want to go ahead and hook up our antibiotic. So with the antibiotic, the IV bag, I'll do the same thing I did with my primary. Of course, I'm going to check the 5 checks against the MAR to make sure it's the right time, the right patient, the right route, the right dose, the right amount. We're checking the bag for the expiration date, make sure that everything is intact and that the liquid is clear. As stated before, I did call the pharmacy to check that this medication was safe. It has been dosed correctly for her. So for another safety check, I'll make sure I get the green light against the MAR here before I hang that.
I already verified the facility that that's at the right rate as well. Thanks for bearing with me today. Do you have any questions about your medications or anything like that? Well, before I go, I just wanted to ask you, what are some signs and symptoms of the medication? Okay, well, again, there's just going to be nausea, vomiting, rash. So those are some things you want to look out for. So can you teach me that maybe just 1 or 2 of these? Great. Can I get you anything at all right now? Okay. Well, I'm just going to let you rest now. Let me know if you need anything, and I'll get it. Yeah, so the first piece of information would be the refined rates.
Okay, so to set up my piggyback here, I'll make sure that this line is clamped before I spike the bag. I'm going to go ahead and lower my primary.
Yeah, if there's any discrepancies, I wouldn't give the medication, for safety. Yeah, I make sure the right route,
And then once again, as I remove this for the spike, I do know that that is sterile, so I'm not going to touch anything.
alright, thank you. Is there any glaring errors? Glaring errors?
Okay, you're going to make sure you find the tube, find the secondary tubing there too. I'm just going to clamp the line and turn off the dial flow. I'll wipe this port before I hook that up. And this medication, the antibiotic is going to be ran at 100 miles per hour, so I'm going to set this low here. I'm going to make sure I watch to get my 5 drops, which we're on drop 2 of 5. I'll watch to get the full 5 drops. I'll set a timer. That's 3. I don't know. Can you see that? Okay. So I'll watch to make sure I get the 5 full drops. Because this is going to run for an hour, I'm going to set a timer to come in and make sure about 55 minutes from now I come back in and start the primary to be running. I'll be in to check on things just to make sure that the tube isn't kinked or anything, and everything's still running in between now and then too. So I'm going to take my gloves off here. I'm going to wash my hands. And since I did administer that, I'll go ahead and hit save there. Okay. I want to make sure that my tubing is labeled here. And Shanae, I want to talk to you a little bit about what we talked about earlier. I told you that I would give you some information on the antibiotic we gave you, so I did indeed do that. Please just let us know if you start to have any itching, anything that may indicate an allergic reaction. I highlighted that here for you. And also diarrhea or loose stool. If you start to experience that, we'd like to know too, okay?
Okay.
Do you have any questions at all for me?
No, not right now.
Okay. And I know we asked earlier, but I do want to ask again here. Are you in any pain right now?
No.
Okay, very good. If you need your pain medicine, you know that you have some that you can get. Just use your call light and let us know, okay?
Okay. Yeah, I've got it right here.
Okay. Thank you. Okay, Michael, do you have any additional questions?
Yeah, just a couple. Were there any pertinent pieces of information you reviewed before administering the client the medication?
So we always do checks against the MAR before we administer medication. I did check for allergies. As stated, I called the pharmacist to make sure that she was able to receive this medication, and we checked her dialysis schedule too. She went this morning, so she was able to receive the med.
Okay. Did this information affect your decision to administer the medication?
Yes, because we didn't see any issues that would warrant not administering the medication, we went ahead and started the IV as ordered.
Okay. And did this information affect how it was administered?
No. Like I said, we just administered as ordered because everything was within normal limits.
Okay, I think that's all I had. Thank you.
Okay, thank you.